let's have a closer look at Article 25 of the UN Convention on the Rights of Persons with Disabilities, the UNCRPD. The UNCRPD is a human rights treaty for persons with disabilities. This binding United Nations document was signed and ratified by all the EU member states and the EU itself. Article 25 recognizes that all persons with disabilities, including persons with psychosocial disabilities, have the right to health on an equal basis with others. The right to health is a central human right. It means that health services must be available, affordable, of good quality, and accessible to all. People with disabilities should have access to health care and programs like everyone else. At all times, health services should be delivered with free and informed consent. If people with disabilities need health services because of their disabilities, these services should be available as close to their homes as possible. Remember Amy? Amy happens to have a psychosocial disability. A psychosocial disability is a long-term mental health problem which, when combined with barriers in society, becomes disabling. Throughout the COVID-19 pandemic, Amy was living at home outside a large city. Before the outbreak, she used to take a bus to attend therapy sessions. But with lockdown measures and the risk of infection, she got very scared. Luckily, her therapy sessions moved online, and she started enjoying the sessions again, as well as taking long walks through the nearby forest. Once the COVID-19 vaccines were administered, Amy felt uncomfortable due to her experience of taking medication. She also felt confused by the disinformation about the vaccines she saw online. Through peer support group, she was able to discuss her concerns. She learned a lot from trustworthy sources such as the World Health Organization website. Amy thinks it's important that people make informed decisions about the use of medications, including vaccinations. Unfortunately, Amy knows some friends living in a psychiatric institution who contracted the virus. People with psychosocial disabilities confined to institutions have been affected by the pandemic more than others, as they are at higher risk of being infected. Institutionalization of persons with psychosocial disabilities is a violation of human rights and a public health concern. Under the UN Convention on the Rights of Persons with Disabilities, we need to ensure that healthcare systems are well-resourced and funded to provide quality care, accessible and affordable to guarantee universal and equal coverage, person-centered, and promote peer-led support. Find out more about the rights of people with psychosocial disabilities at www.mhe-sme.org.